Greetings to everyone. My name is Teo and I am from the Universiti of Malaya eHealth Unit. I am grateful today to be able to share our work with everyone, which is entitled The Utility and Usability of an Automated COVID-19 Symptom Monitoring System, COSMOS, in primary care during COVID-19 pandemic, a qualitative study. I am presenting this work on behalf of my team from the University of Malaya. This is the outline of my presentation today. I will be covering the introduction, methods, results, discussion, and conclusion. Now, let's go to the introduction. COVID-19 cases has reached about 200 billion cases globally, and in Malaysia, the daily cases has peaked at about 18,000 cases on the 31st July 2021. We are grateful that most of the cases are asymptomatic or mild. Once diagnosed, asymptomatic or mild cases are sent home for self-quarantine due to the lack of bed in the hospital. At home, patients often do not know when to seek help in a timely manner, and they often present to the hospital when their conditions are already severe. The district health office are tasked to call the patients in a daily manner to monitor their conditions and guide them accordingly. However, this is not smooth due to the lack of healthcare manpower to cater for the huge number of COVID-19 patients in Malaysia. Besides that, patients did not answer the phone and patients are uncooperative. Hence, there is a need of a more efficient telemonitoring system to monitor these patients in need. Our team has created the COSMOS, the COVID-19 Symptom Monitoring System. COSMOS consists of a chatbot delivered within the Telegram app for the patient and a dashboard for the doctors to monitor the patient's condition. COSMOS provides automated feedback to the patients based on their risks. Instead of calling everyone, which we do not have the resources to do so, COSMOS filters out stable patients and highlight unstable patients for the doctors to manage. This is a more efficient use of healthcare workforce while ensuring that patients who need attention are taken care of. Patients with no or mild symptoms are asked to activate COSMOS in their phone. They will receive a ping in Telegram automatically every day at 9 a.m. to submit their symptoms to the COSMOS bot. The COSMOS bot will provide automated response whether they can stay home or they should call the doctor as soon as possible. When the patient calls the doctor will further assess the patient's condition by a teleconsultation and advise the patient whether they can stay home, continue using COSMOS, or they need to go to the hospital immediately. The COSMOS doctor at the same time also will monitor the COSMOS database, and the COSMOS will alert the doctor if there's any serious case that needs attention. The doctor will also call the patient if the patient do not call the doctor. That is basically the concept of COSMOS and how it works. This study reports the utility and usability evaluation of COSMOS with the patients and doctors before it is being launched for clinical use. In terms of the methods, the qualitative approach was used to evaluate the utility and usability of COSMOS, and we have obtained research ethics approval from the ethics committee in our hospital. This study was conducted in the outpatient primary care clinic and the emergency department in our hospital, and it was conducted last year in April to May 2020 after the development has completed. The universal sampling approach was used to recruit all patients and doctors who have used COSMOS to join this study. We recruit patients and doctors until data saturation has reached. In terms of recruitment, patients were recruited once they completed 14 days monitoring, and the doctors who have used COSMOS for at least 1 week were recruited. For patients, individual in-depth interviews was conducted via phone call. For doctors, the IDIs were conducted face-to-face. All interviews were guided by a topic guide developed based on the nuisance model of usability and utility. The participants were asked about their opinion regarding their experiences in using COSMOS, the recruitment process, as well as function and features in COSMOS. In terms of data analysis, all recordings were transcribed verbatim, and the thematic approach was used to analyze the data. Open and axial coding were independently done by 2 researchers, and the findings were mapped onto nuisance model of usability and utility. The final themes were agreed by the whole research team. Now, let's look at the results. 11 patients and 4 doctors joined this study. The mean age for the patients is about 40 years old, while for the doctors is about 35 years old. The teams are divided into two, utility and usability. Utility is about the functionality of the application and how useful it is to the users, while for usability, it is about how easy to use and pleasant are the functions to the user. There were 5 sub-themes that emerged under utility. First, Cosmos is found to provide close monitoring for patients who were quarantined at home, as the patient said you get kind of reassured that everything is okay. The participants also mentioned that Cosmos provide continuity of care to the patients and rapport was built during the monitoring. Besides that, participants also expressed that the Cosmos provides timely decision support for both patients and doctors. The reminder was also good to ensure that the patients report their symptoms regularly so that to ensure that they are safe. As the patient mentioned that it was really good because sometimes I used to forget. The doctors also mentioned that Cosmos reduces workload and also protect healthcare workers during a pandemic. In terms of usability, it was found that familiarity with existing apps smoothened implementation as the Cosmos is run in Telegram app instead of developing a new app. The patient said that the process is easy, just search for Cosmos in Telegram. It's not difficult at all. There were 2 sub-themes under this theme. First, unfamiliarity with app poses challenges in installation. Some patients are more familiar with WhatsApp and they need to install the Telegram app, hence facing some hiccup initially. However, the patients were happy subsequently as they were able to set up Cosmos with the detailed but easy to use onboarding guide with the doctor's explanation. The second sub-theme under the usability is user-centered and evidence-based content of Cosmos. First, the patient mentioned that the questions are very simple and easy to answer. The interface is very user-friendly and easy to use. There are only about 8 to 9 questions in Cosmos and they are phrased in a very simple manner. The patient just need to tap on the options provided. One issue emerged is that Cosmos did not include the question on anosmia, which is loss of sense of smell. Cosmos was developed in March 2020 and anosmia was only reported as a key symptom of COVID-19 in April 2020. We subsequently added this question in Cosmos to keep updated with the rapidly changing scientific evidence. The third sub-theme under this theme is mismatched needs between patients and doctors regarding the free text feature. There was a free text open box for the patients to key in anything they want in Cosmos initially. The medical team feels that it is a safety netting to capture anything not asked in the above questions. However, it created problems for the doctors as some patients typed in many non-COVID related issues. This was subsequently removed to focus on COVID-19. There is another issue on the question, is your face or lips turning blue, as the patient do not understand how to look at the blue. However, this was not changed as it is recommended in the clinical practice guideline for COVID-19. Last but not least, Cosmos is a standalone system and the doctors have to open the hospital electronic medical record to check on patients' other information. The doctors prefer if Cosmos is integrated with the hospital electronic medical record. Let's move on to the discussion. Generally, the qualitative evaluation revealed that Cosmos was well received by the patients and doctors. It reassured patients and optimized healthcare resources. A hybrid system, automated plus teleconsultation by the doctors is preferred instead of just a fully automated system. It is a challenge developing a system to cater for a pandemic as the scientific evidence keeps evolving. A system that can rapidly evolve is required. We initially attempted to use WhatsApp to cater for user familiarity. However, it took too long to obtain approval from WhatsApp to get its API. Telegram also have a good user interface with buttons, and it is also being promoted by the governments in disseminating information about COVID-19 to the public. Other example apps, for example developed by Yordanov, has a steeper learning curve for the users. There is a need to consider an approach with less steep learning curve to ease implementation of the new product. The strength of this study is that we explore the views and experiences from both parties, the patients and doctors. This allows us to have a richer data and allow triangulation. The limitation of this study is that we did not recruit patients who refused to use Cosmos, and we conducted the interview using the phone instead of face-to-face, where we may have lost verbal cues from the patients. In conclusion, an algorithm-based chatbot home monitoring application coupled with a dashboard for monitoring and teleconsultation is feasible to be implemented during the COVID-19 pandemic. We hope the findings from this study are useful for the ASEAN community when designing COVID-19 response and recovery plan for the patients. In terms of future direction, Cosmos is currently being used as a service in our hospital. We are currently analyzing the data on its effectiveness in improving health outcomes, quality of life, and cost effectiveness. We would like to thank the funder, the collaborators from computer science, as well as the department and University of Malaya Medical Center for supporting this project. These are the references used in this study, and thank you for listening.